Thank you, Alex. Thank you, Haraya. So my name is Paige, and I practice primarily out of Hammonds Plains. I have lived in Hammonds Plains in Nova Scotia my entire life. I call this province home. It's beautiful. I love it, and I'm really happy that I get to practice here now. So I wanted to talk about understanding your health from a health literacy perspective and kind of why that's important. And we'll get back to kind of doctor's teacher that Haraya alluded to previously. I wanted to start with just kind of defining health literacy and kind of where that'll take us through the rest of it, right? Because literacy is our ability to read and then understand everything, right? Not just to read it, but to understand and put that in practice. And the same goes with health literacy, right? It's our ability to read something, understand it, and then put that health information into practice, which is extremely important. But it's kind of like, well, why is that important? Where you're like, I'm not visiting a doctor every day. I don't need to understand them every day. But there's definitely everyday occurrences where we need to be able to understand information that's been given to us. It's as simple as, understanding instructions on a medication bottle, reading nutrition labels at a grocery store, and reading and thinking about safety online, right? Because we live in a digital world and all of the information online and being able to kind of sift through that. So we come across the need to understand health and need to understand our health on a daily basis. That being said, there's a lot of things that get in the way, right? Education is a big one, right? If you've had the privilege to be able to go through school, high school, let alone secondary education, right? Then you're most likely starting off with a greater level of understanding when it comes to reading and everything. If you weren't as lucky, then maybe you don't have as great of understanding, which can get in the way of understanding instructions or diet plans or anything that a practitioner would give you. We also look at language barriers. There's a lot of information here in Nova Scotia on health. It's almost entirely in English. Even if you're part of our French language speaking population, the creativity and diversity there, it's not the same as the English language, right? So maybe in your first language it's amazing, like you have the best health literacy ever, but having that same kind of translation to the English material that's presented here can make it a bit more difficult. We also look at accessibility and affordability, right? Do you have access to a doctor? Do you have access to someone you could ask a question to if you didn't understand something? Could you afford to go see someone else? And so that's just a few of the things that can get in the way of our understanding from an everyday perspective. And to kind of put that into the larger perspective, I wanted to look at kind of our understanding of health from both the national and the provincial level. So there's some not great statistics up there. In 2021, it was estimated that over half of Canadians were below a high school level of reading, which seems a little crazy, but that's 50%, that's half, right? If we took the room and divided it down two, we could potentially estimate that half of us didn't either graduate high school or maintained a level of reading that would allow us to understand that. Which is difficult because the majority of the health information presented is done so at a high school level or above, right? So that means that you are missing 50% of the target audience. 50% of people are not going to understand it, all right? The more shocking one, though, is that 88% of our seniors are not literate enough to read the instructions on a pill bottle. That's a really big number. So if we are trying to help people as practitioners, right, or you as the public is out in life trying to understand things, right, and the information is presented at a high school level, right, or it's all in text and there's no audio, there's not another language for it, or someone to be able to help sift through those issues, right, we can see how this might be a problem. And I'm going to come to that being a problem in a second. To bring it to the provincial level, we're also not doing great here in Nova Scotia, unfortunately, as much as I love this province. It's estimated that only half of Nova Scotians understand health information well enough to make informed decisions. So we go back to the first slide in that, it's not only reading something, but it's reading, understanding, and then being able to put it in practice. So again, about 50% of us aren't able to put that into practice, whether that be a diet plan given by a doctor or pill instructions from a doctor or something you saw online that you really wanted to try. Not fully understanding it is part of that. And then some older statistics just about Nova Scotia at the end there. In '96, we were at the bottom of the barrel for all of Canada in terms of our ability to read, write, and understand. That's not great. And by 2005, we had finally met literacy standards, so we're like, yay! But that still only put us at mid-pack compared to all the other provinces and territories. This, unfortunately, hasn't improved a whole lot as we look at the first one in terms of only half of us fully understanding it. So we know that most of us might not understand health-related information. What does that cause, though? What are those consequences? I broke it down into 3 kind of main categories. The first one is errors, right? So if you're given an instruction, but you don't fully understand it, you're more likely to make an error on that. In the instance of like the pill bottle, right? Because we know 88% of the seniors can't read and understand it. That means you're either taking too much, you're not taking it at the right time, you're taking too little, which means you're not getting the full benefit that could help you improve your health as would be if you could understand it. The same could go with like instructions from a physiotherapist, right? If they're telling you, do this stretch this many times, if you didn't fully understand what they had given you, you might do it wrong and injure yourself more, and then you're back at the physiotherapist again, right? So it's this continual cycle of not getting that full health benefit. We also then look at progression. So if you have, let's say you go get blood work done, your sugars are high, and the doctor says, oh, you've got prediabetes. We're going to fix your diet, we're going to do some lifestyle. We'll come back in a few months, see how things are, and kind of go from there. If you didn't fully understand the consequences of what happens with diabetes, if you don't fully understand what can happen if it's untreated, then what the statistics say is that you're more likely to proceed from prediabetes to diabetes, right? The same goes with cancer. If you don't have access to a doctor, if you don't understand your symptoms, and you don't, raise your hand and say, hi, I need help, or I'm not feeling great, and you don't have that access, you're more likely to present to the hospital in a later stage of cancer when there is potentially less we can do. So this is where we get to the consequences of it, right? Like if this person had understood it, understood their health, understood where they could get help, then potentially we could get to the prevention aspect of things, right? Before things progressed along. The third category is, of course, the dangers, right? And I bring this mostly back to the online world we live in. There's so many health claims out there, and if you see something, you're like, oh, wow, that looks really great. I want to try that. I think it could really work for me, but it might be dangerous for you, right? It might not be what you need, and so it poses a potential threat to the overall health you have, and that's why healthcare professionals stepping in can certainly help that. It is Naturopathic Medical Week, so I would be remiss not to say something about it. And this is where we get back to naturopathic doctor as teacher. So like Haraya said, the docere means to teach. So we took an oath to teach, whether that is educating patients one-on-one, whether that's in a group setting like this, or courses online. It's something that not only naturopaths, but other professionals, it's part of what they do, part of the profession, right? We should be teaching, we should be explaining and taking that time. And that's where we get the different things that we can do, right? Because we looked at the consequences of what happens when people don't fully understand. We looked at the things that get in the way of people not fully understanding. But these are the things that the professionals can do to help, right? That's the education, the one-on-one. It's patience, it's understanding, right? It's being non-judgmental when someone asks a question and they're like, I don't understand this, or they ask the same question twice. Something wasn't understood, and it's our job to make sure that people understand that. It's also making sure that we're accessible, right? And we're approachable, and that people can ask those questions. And remembering that, we go to school for way too many years, and we live and breathe in this bubble of medicine and health and wellness. And then we graduate and we go to work in hospitals and clinics, and we live and breathe in this bubble of health and wellness. And to be able to change our language and change the way we look at things, to be able to interact with people who might not live and breathe in everything that is health and wellness, is something that's extremely important, but also might actually require more education on our part to make sure that we are essentially achieving that goal after the fact. That being said, it takes two to tango, all right? So it's more than just the healthcare professionals when it comes to health. This is where Haraya had said, like, if you teach someone to fish, right, they're gonna survive longer, essentially, and not have to keep coming back. And so as much as, in the middle asking for help from your healthcare team, from your friends, your family is super important, you also kind of need to take the reins into your own hands and go for it. And that could be asking for help if you're not used to doing it already. It could be accessing the resources that are available to you, right? We are in the public library. And they have so many books, novels, magazines, online resources of health and wellness information in English and in many other languages as well, especially online, as well as the Nova Scotia Health Authority's public library. They have online resources that are free to use, right? So it's about finding resources that are free and accessible, asking for help when needed. And when we came back to the dangers of online, I'm not sure if anyone remembers the North American house hippo, but it was a concerned parents advertising commercial here in Canada in like the 90s or 2000s. And the whole idea was that you can't believe everything you see on TV. And I think that the onus of not believing everything you see online or not believing everything that you're told and kind of taking it with that grain of salt is one of kind of the most important things when it comes to taking care of your own health, right? You can ask your questions, you can find your resources, but if you don't have the literacy, right, the ability to take that information and decide, like, do I need a second opinion? Do I need to ask for help? That's where we get our shortfall, right? 50% of people not understanding something, that's not community, that's a divide. And so going to talks like this, seeking the resources, thinking twice about things, and also kind of encouraging the professionals you do know to talk about and understand and help people actually understand their health is something we need to do better on. But I think we can kind of collectively as a province and as a community improve our ability to understand our health. Yeah. So we're taking questions way at the end, but I believe it's Umut's turn, right?